Good afternoon, Miss. I am Angelica Villarreal Sarsa from DSN Group E3, and today I'll be performing the perennial care. So first is we need to identify our patient, introduce ourselves, and also explain the procedure. So ma'am, good afternoon. I am Angelica Villarreal Sarsa from South Hospital, and I will be your student nurse for today. May I know your name and when is your birthday? Okay, thank you, ma'am. So today we'll be performing the perennial care. It is a cleaning technique that is done to clean your external genital area using a sterile technique. This is usually done before catheter insertion, vaginal delivery, and also surgery. This will help us prevent infection and also to maintain patient hygiene and dignity. After that is we need to prepare the 6 sponges that are soaked into an antiseptic solution or iodine. Make sure that in picking them up, we are going to use the forceps. After that is we need to position our patient into a lithotomy position. We're going to help the mother lie down on her back with their hips flexed and knees apart. Also, heels are on a stirrups or a pillow. This will give us a full visual access of the vulva and perineum for us to clean it thoroughly and for us to keep a sterile feel. After that is we need to perform hand washing or hand hygiene. This is for us to keep the spread of microorganisms before doing the procedure. Next is we need to apply sterile glove for the procedure. This is to create a barrier between our hands and the sponges for us to prevent cross-contamination. And then we need to take a fresh sponge to begin with each new area. Make sure that we do not return into a clean with a used sponge. That is why 6 sponges are needed. It is a one-way technique to prevent the organisms coming from the dirty area going back to the clean area. Then we need to apply or do a zigzag motion starting from the clitoris to the lower abdomen, just about the pubic hairline. This is to clean the mons pubis, which hair shed and sebum before moving it outward. Then next is with another sterile sponge, we are going to clean the inner thigh using a zigzag motion starting from the labia majora to about halfway between the hips and the knee. This is hard. Then do it on the other side to ensure that both sides are being decontaminated for us to prevent cross-transfer contamination. So if you are wondering why we are doing it in a zigzag motion and not in a one sweep straight, it is because zigzag lifts debris much better than a one sweep, and also for us to avoid cross-contamination and spreading the germs. Then next, oh my god. Sorry. And then, with another sponge, we're going to clean both sides starting from the clitoris to the labia majora, perineum, and then anus. making this, we are cleaning starting from the most cleanest, which is the clitoris, to the dirtiest in the one direction for us to prevent anal bacteria coming from the genital tract. Then do it on the other side. To complete the perennial care. Then, for the final sterile sponge, we are going to do it on the midline, starting from the clitoris, one strip only, clitoris, over the vulva, and perineum. So the final central strip captures all the residue left in between the labia. So we are done. We're making the midline last because it is now the most dirtiest zone. And then after that, we're going to remove our gloves. Start and then perform hand washing or hand hygiene for us to ensure that our hands are clean after touching the patient.